with no further ado, I want to give a warm invite to Scientific Director, Dr. Roger Packer.
Thank you, David. Once again, I'm Roger Packer from the Children's National Health System, and I've had the opportunity to be involved in direct brain tumor research for over 3 decades. My major motivation for remaining involved in brain tumor research isn't very difficult. You look down this table, we have 2 parents who have found the strength to continue to work on and raise money for this field and raise all of people's understanding of these problems who've lost Sydney and Mason not that long ago. And if that isn't motivation enough, I don't know what is to keep working in this field. I've been fortunate over the past 3 decades to see things improve for some subtypes of childhood brain tumors. For one of the most malignant variant, the medulloblastoma, we've raised survival rates from about 50% to 90%. So there has been some progress made. For pediatric low-grade gliomas, where we used to either have to do very destructive, often surgery, or radiation therapy that could hurt the brain, we now have new drugs that are targeting molecularly the tumors and making significant gains. The major difficulty remains in pediatric brain tumors is trying to do something for pediatric high-grade gliomas, especially the most malignant variant of that, the diffuse intrinsic pontine gliomas, or DIPGs. Unfortunately, the same type of survival rates that we quoted 30 years ago are what we are quoting now to families. And as we take a look at these children, we know despite what we do that 90% will be dead within 18 months if they have a DIPG. And that's the same as it was in 1990s and 2000s, and it is in this era. The variety of reasons for that, we didn't understand the disease. We, in many ways, thought it was just a pediatric variant of an adult disease, that whatever we did for adults with high-grade gliomas, which is the most common malignant tumor that adults develop of the central nervous system, that we could just hand that down to children. And decade after decade, we failed. And now, finally, over the past 5 to 7 years, we have the molecular tools to show us for the first time that even though under the microscope these tumors may look identical, they are molecularly different tumors. So there was no rationale to think why it would work in an adult and didn't work in a child. So that was one of the things. The second is we just didn't have the tools. We didn't have the tools that the scientists could use to understand the molecular makeup of these tumors. But that's changed over the past few years. That work by the labs that I'll talk about in a few minutes, work being done at Children's by Dr. Nazari and others, clearly can start looking at what the molecular makeup of the tumor is, which would give us, for the first time, a target to aim at, a legitimate target, not just one we sort of thought might be there. So when you put those 2 things together, and then the understanding that families really want to know, they want the tissue of the children who have these kind of tumors to not only help them but help others, we have finally built a nucleus where we can make real progress in this disease. And over the past 3 to 5 years alone, we've looked at and found some of the major drivers of pediatric high-grade gliomas. Genetic changes that are called oncohistones, things that change the structure of the DNA in these tumors. And interestingly, these are not fixed changes. They can be rewrapped because they're talking about how the DNA is being formatted, and it can be rewrapped to possibly control the tumor. These are great advances. The difficulty that we've had in this field is that we seem to take 3 steps forward and then 2 steps back. We understand part of the picture, but we don't understand the entire picture. And in those ways, we can't make the progress we need to do. So when the National Brain Tumor Society came to me a few years ago and said, what do we do to try to defeat pediatric brain tumors, especially aiming at high-grade gliomas, we thought about let's put together the best scientists in the leading laboratories, scientists that are not only leading the charge in their own laboratories, but have a track record of working and cooperating with others. And let's try to put them together to try to accelerate this. Dr. Baker will talk about the lab at St. Jude's and the work she's doing as one of those scientists. A second is Dr. Stefan Pfister, who is arguably the leading pediatric brain tumor researcher in Europe. He will lead the efforts trying to look at more molecular targets, identify those targets. Dr. Nada Jaboda's laboratory in Montreal, bringing the Canadian group, has published multiple papers on high-grade gliomas and also has started working on a variety of different ways to better understand exactly what drives these tumors, the genetic contributions, and even a potential way of looking at the blood to determine if we're being effective in these tumors, something called liquid biopsies. Getting all these people to work together and knowing that they will, in addition, bring in other laboratories from across Europe, from across the United States to work together is really sort of one of the major steps we can do to accelerate the brain tumor research. So that's what NBTS wanted us to put together, and that is what the scientists have agreed to. As David has said, they will work together. They will share their data immediately. They will not wait for the paper to be published. Things won't be held in the back. This is a collaborative working together, and anybody who's going to work with these laboratories to utilize the knowledge they have will have to agree to also share their data immediately so we have no delays. So one of the other missing or gaps or missing links in these is that sometimes it's difficult to get industry to share the drugs or even to allow us to share tissue from one laboratory to another. What the NBTS has promised as part of this initiative is that we will have a core of lawyers, scientists, and also working with industry to make sure there's immediate sharing and that we don't get hung up on material transfer agreements and this drug can't be given to one laboratory or another. So we'll be sharing across the laboratories. So we'll have the best laboratories who'll be working with a group of other laboratories outside those areas, and there will be a core to get the drugs and the specimens to these investigators and others immediately to try to accelerate the research. The missing part of that remains now how do we translate that into more effective therapy? And I really believe that the NBTS Defeat Pediatric Brain Tumor Initiative is going to be agnostic in who they work with. If there is a group, and there are multiple wonderful groups like the Pediatric Brain Tumor Consortium, the Pacific Neuro-Oncology Consortium, others, industry, that have drugs and ways to get these to patients sooner, we'll work with that group. Our goal is not only science for science sake, is to have these things that we're learning translated into better therapies, not 10 years from now, hopefully not even 5 years from now, but in the next 2 to 3 years. Maybe our first studies with these molecular studies or even the immunotherapies may not be the perfect one, but we want to stepwise make progress in this field. My role is fairly simple, and it's probably the least important. My role is to just keep pushing the scientists, pushing everyone to work together to get these things to patients sooner. We're going to be safe. We're going to hopefully not hurt anybody. We're going to use Dr. Baker's information to say, is the target there? Is it an effective way to look at this? But we're going to try to get these out to patients. And my weakness and its strength as a researcher has always been my impatience. And I'm very impatient about this disease. And my colleagues, Dr. Gilbert, Dr. Wong, Dr. Nazarian from Children's National, will tell you how impatient I am at this disease. And this is what we have to do. We have to push the envelope. We have to take the next steps. We have to work together as a community. And I thank the National Brain Tumor Society for putting this together, for trying to support these laboratories, and hopefully to make major differences in the next few years, not the next decade.